I am going to be going over the labs for Susie Smith. She's 48 years old, waitress at a busy restaurant. She smoked cigarettes for 20 years, vaped nicotine for 3 years, minimal exercise, family history of heart disease. She's on Lasix and normal saline at 100 milliliters per hour, and her complaint is a new onset chest pain, and she's located on the cardiac floor. So we are going to start with her BMP, sodium potassium chloride bicarb, her BUN, creatinine, and her glucose. So for sodium, the normal range is 135 to 145. And this test will evaluate fluid and electrolytes, acid-base balance related to neuromuscular, renal, or adrenal function. Her labs went from 138 to 136 down to 134. Slight decline could be due to her diuretic therapy or IV dilution. It's not a cause for concern at the moment, but you would continue to monitor. And then her potassium is 3.5 to 5 is the normal. And this evaluates signs of excess or depletion and also goes again with the acid-base balance. Her labs were 4.2, 3.8, which were trending down but still within normal, and then 2.6, which is under that normal range. This could also be due to her diuretic therapy and possible insufficiency in her diet. This is a cause for concern. You would want to contact the provider and assess for arrhythmia and ask about their diet and get that level up, as like I said, it can cause arrhythmia. Chloride, 96 to 100 is the normal. This detects acid-base imbalance and evaluates fluid status. She was at 102, 100, which was still in normal limits, and the 98, which is also still within normal limits, but further declining due to her diuretic therapy, and also can kind of coincide with that sodium, and it's not a cause for concern. You would continue to monitor. And then her CO2 or bicarb, normal range is 22 to 25 or 26 depending on where you're looking, and that is also to determine acid-base level in the blood. Hers were 24, 22, and 23, all within normal limits, so no metabolic acidosis there. You would assess the patient for fatigue or breathing issues with that. Her BUN, normal range 8 to 20. This evaluates kidney function, assesses for hydration. She was 15, and then 18 trending up, and then 22 where she went over the normal limit. And this could be from decreased renal blood flow due to the dehydration or diuretic therapy. Mildly concerning. You would want to monitor future labs for that and see if those diuretics are doing harm at this point. Her creatinine, normal 0.6 to 1.2. This assesses for the GFR and screens for renal damage. She was 0.9, 1.2, which is a normal but going up, and then 1.4, which is past that normal, but just barely, very slight. And again, this could be from impaired renal clearance due to that dehydration, and you would monitor those labs of BUN and creatinine again. Glucose, normal is 60 to 110, and this assesses the blood glucose, 105, and then 110, which were both normal but trending up, and then 125, which was up. It's not super high. I did put possible diabetes, but also when was her last meal? Did she just eat? Could be a cause for concern, but again, you would want to ask her when her last time she ate was. And then we're going to go to the CMP. Her total protein, 3.5 to 5.5 is the normal, and it diagnoses hepatic renal disease or protein deficiency. She was at 7, 6.8, and 6.5. All three of those are high, and this could be due to dehydration or diuretic therapy. It increased, but it is trending down, which is good. So hopefully those fluids are helping her. Albumin, 3.5 to 5.5 is the normal. This determines if there's enough protein being absorbed in the body. She was at 4.2, 4.0, and then 3.8, all trending down, but she's still within normal limits. Still cause for concern because it's going down. You would want to monitor those labs moving forward as well. It shows her body is absorbing the protein, but you would continue to monitor those. Her AST normal is 10 to 40. It detects acute hepatic disease, heart, kidney, tissue disease. She was at 22, 30, which was still within normal but trending up, and then 42 where she goes over that normal. This could be due to dehydration or her diuretic therapy, and then I put that the ALT will tell more if this is a liver issue or distinguish between that. And then we have ALT, 8 to 35 is the normal. This distinguishes between myocardial or hepatic tissue damage. She was at 25, 32, both within normal but trending up, and then 45 where she goes over. This could be from liver damage, but it also could be due to the dehydration that's going on in her body or inflammation. It could be a cause for concern. You would want to check the urine color and also the color of her skin and see if she has any jaundice. Total bilirubin, normal is 0.1 to 1. This evaluates liver function. She was at 0.6, 0.8, both with the normal but trending up, and then 1.2, barely over that mark. And again, this could be something like hepatic damage, but all of these could be due to this dehydration that she's probably having. This is not a cause for concern as it's barely above, but again, assess the patient for skin color, fatigue, lethargy, things like that. And then you have the ATP, normal is 50 to 120. And this is a supplement, gives you kind of supplement info to other liver tests. She's at 130, 128, 133. And this could also show like liver disorder or liver disease, but you would want to look at all of them as a whole. These are all high. And I put liver or skeletal disorder, and you would assess the patient for bone pain and again skin color. And then procalcitonin is less than 0.1 for the normal, and this determines infection, whether bacterial or viral. She had a slight up at 0.21, and again, this could be inflammation, stress, infection. I would draw again and see what that was at and check it with lactate. So the CMP altogether kind of just tells me that most likely it is due to dehydration because, as said in the lecture, you could have up to 2 times the highest amount on here, and she's not even at that. So I would look into her diuretic and see if that's doing harm. And then we have a CBC with differential, white blood cell count. Normal is 4,000 to 11,000, and this determines infection or inflammation. She was at 7,200, and then 12,500, which is going up, and then 17,000. So that's where, these last two, she goes over the mark. Possible infection could be concerning. Check with differential on there, and it could be due to that dehydration and, stress that her body is going through at the moment. Hemoglobin, her normal 12 to 16, detects anemia or polycythemia. She's at 13.5, 12.8, and then just dips down right under that 12 mark at 11.2. This is not concerning to me, as it's not very low. I would check again. Same with her hematocrit, 36 to 48, and this detects the same thing along with hydration. She's within normal limits until her last one at 35.5, barely under that 36 to 48. And this could be due to hemodilution from all those fluids that she's getting along, kind of going back and forth with the diuretic and IV fluids. Platelets, 140,000 to 400,000 is the normal. You would evaluate, this evaluates platelet production, The first two, she's within normal limits. The second one, she's at 410,000, which is just above. And also that could be, does she have any inflammation or that stress in her body? This could be a cause for concern with how much they went up. She started at 150,000, and by her third draw, she was at 410. So definitely could be a cause for concern. You would want to look further in that to see, you know, why they went up so quickly. Neutrophils, normal is 45 to 73%, and this detects bacterial infection. She was within normal limits for her first one. The second two, she's trending up and over that 73. And this could be the stress that's on her body or infection, slight elevation. Continue to monitor that as well. Lymphocytes, her normal, or the normal, is 20 to 40%, and this detects viral infection. She's within normal limits for the first one, and then the second two, she is trending down below that 20, and this could be a kidney issue, which we saw before in her labs that her kidneys were having a little bit of a problem, and also could be due to illness. Not super concerning. We would continue these labs, although that they are going down and they did drop in half. So you would want to rule out any, type of virus and see if it was more of a heart or kidney issue with that. Monocytes, normal is 2 to 8%. Can diagnose infection or other cancers. She was within normal limits for all of them. No concern. Monitor further. With the next CBC, eosinophils, 0 to 4% is the normal, and this can be a detection for an allergic reaction or allergy. Again, within normal limits, no allergy response saw. Basophils, 0 to 1%, and this detects inflammation and allergic response as well, and she's within normal limits for those two, so no cause for concern. Continue to monitor. Coagulation and inflammatory markers, lactic acid, 0.5 to 1 is the normal. This detects lactic acidosis and can assess cardiogenic shock. She was up for the first two at 1.5 and 1.4, but then she slowly went down. So that tells me that the fluids should be helping getting that lactate out of her body. And help clear it. So she was having an issue when she first maybe came in, and then maybe those fluids are starting to get rid of that. Continue to monitor the levels to make sure that they stay within normal range. D-dimer, the normal is negative or less than 250, and this can be used to diagnose DIC, but it also is tells you kind of that there might be a clot in the body, or it could be a false negatives. She was at 300 for one, which is obviously high, and then 620 for the other, so it kind of doubled. So she could have a possible clot somewhere, or is it a false positive? You want to look more in that. You would contact the physician, but it needs further assistance with a Doppler or a CT to see if there's anything like that going on. Thyroid panel, TSH, is 0 to 15. For the normal, and this can confirm or rule out hypothyroidism. She's within normal limits for all of those, and you would assess T4 levels and the patient to further get a better look at what's going on. And then the T4 levels, the normal is 5.4 to 11.5, and this evaluates thyroid function. And she was low for all three of them and trending down. And this leads me to believe maybe possible hypothyroidism. I would need to look more into the patient, ask them about weight gain, fatigue, bradycardia, depression, and so on. And then we have her cardiac, where the cardiac scoring, the normal is 0. This detects plaque in the arteries, and all three of hers are 150. This tells me that she has a moderate amount of calcified plaque in her arteries, which is concerning because it gives her a higher risk for myocardial infarction. And then we have troponin I. The normal is less than 0.35, and this detects an MI or a cause of chest pain. Her first was 0.12, which is normal. Her second was 0.35, right at that line to be abnormal, and then her third was 0.5, so also abnormal. So these are high. Possible cardiac injury, I put or renal disease, but most likely with it trending upward, she has some type of ischemia or heart attack going on here. And this is concerning. You would check the CKMB, tell a physician, and also after, if the physician decided to do a cath, or after they figure out what's going on, you would also want to check those within 5 days to make sure those are trending down. And then you have the BNP, which is less than 100 as the normal, and this helps determine or diagnose heart failure and the severity of it. Hers was 842, which was a lot higher than less than 100, and this indicates heart failure. This is very concerning. You would want to contact the provider and assess the patient, as well as go over their kidney labs, because it kind of all correlates together. If she's not having good cardiac perfusion, then that's why she's having trouble with her kidneys as well, and they would want to look into possibly changing her fluid as well as her diuretic, and go over all of that. I will take a picture of these and send them to you. Thank you.